Hi, Nightingale Heroes. Jan Strong here, respiratory therapist with Nightingale. And as promised in our part 1 and part 2 series about why is it so hard to quit and stay quit smoking or vaping, we mentioned NRTs or nicotine replacement therapies. And we wanted to do a few more minutes today to let people know a little bit more about those NRTs. So first, know that there is a difference in the prescription medications you may get from your doctor and those over-the-counter nicotine patches, gum, and lozenges that we see under lock and key at our local pharmacy. The prescription medications, like Chantix and Zyban, to name a couple, they are usually designed to help with the mental aspects of habits or addiction that we have been talking about. You need to talk to your doctor about these and if they are right for you. And there are also even nicotine inhalers or nasal sprays that your doctor might prescribe. But as far as the NRTs go that actually provide nicotine to your body, yes, they can work, and in fact, they can be very helpful. They have been scientifically researched in clinical studies and are approved for ages 18 and up. The nicotine in them comes in different milligrams. Let's look at the patches as an example of that. They come in 7, 14, and 21 milligram strengths. If you smoke more than 10 cigarettes per day, then you would probably use the highest strength first, the 21 milligrams. You will gradually step down to the 14 milligram and then the 7 milligram, maybe over a few weeks. The end goal is to have these help you gradually cut down on the nicotine you are addicted to so that those cravings and that withdrawal won't be so unbearable. Those gum and lozenges come in much smaller dosages, and people who use those usually pop one in their mouth to give them a little extra boost when they are having a particularly hard craving. They typically don't offer enough nicotine to be used on their own. You know, if someone goes into the hospital these days and they smoke, they are usually pretty quick to slap a 21 milligram nicotine patch on them. The reason is that they have trouble fixing what someone's admitted for if they are going to be going through nicotine withdrawal while in the hospital. And to end, I really must caution everyone again to talk to their physician about nicotine replacement therapies before beginning them. Remember in part 1 of the video, we talked about nicotine being hard on the heart. It really does increase your heart rate, blood pressure, and even the flow of blood to your heart. So you definitely want to ask your doctor about using any nicotine products before you buy them. So that's it on NRTs today, or nicotine replacement therapies. Again, we here at Nightingale love to educate you guys on things you might have questions on. It was great talking to you about NRTs today, and we will see you soon for another video.